I want to thank everybody for coming out. Let's see if I can get this to work. My name is David Demore. I'm the Executive Director of the Lincy Institute in Brookings Mountain West. If you're not familiar with us, there's a little information about us. We're 15 years old, founded in 2009. We have 6 main research areas: economic development, education, governance, health, nonprofits, and of course, what's that last one up there? Social services, sorry about that. And what we end up doing is supporting research, either conducted in-house or contracted out, to essentially lay the groundwork for policy interventions. So some recent work we've commissioned, we did an analysis with Trip Umbach, who's done quite a lot of bit on the healthcare economy in Southern Nevada, looking at the potential for an academic health center in Southern Nevada. We also had Brad Wimmer do a piece on broadband. As you're probably well aware, the state's getting lots and lots of money to deploy on the broadband initiatives there. And so this provides a little bit of a pathway for how we can move forward there. The main way we disseminate a lot of our work is through something called the Data Hub. The Data Hub now has, 11 different areas on that there. And in many ways, the Data Hub was a creation of COVID. So thinking back 4 years ago today, we had Brookings scholars didn't stop coming out. We had all these really great research, student researchers, and we wanted to put them to work. And as it turned out, COVID was a source of a lot of data. So we ended up actually doing about 20 different fact sheets and data visualizations on all the different aspects of COVID here. And yes, you're going to see them all. These are primarily essentially secondary data from national reports or regional parts, which will take out the data for the Mountain West, for Nevada, from the metros within Nevada, to sort of draw attention to them. Very, very short, couple pages generally there on that. And as we walk through these, it'll give you a sense of all of the sort of the depth and breadth of the challenges that were created by COVID, both short-term and long-term. So obviously the first one being public health. So this is a data visualization Font Manazos did for us, looking at essentially across the Mountain West, ICU beds, hospital beds, and what would happen as the pandemic continued and more people were infected with COVID. What were the capacity issues on the healthcare front? And there's 3 fact sheets associated with that one. That's the one for the data visualization. There's one on hospital capacities in Nevada counties, and then also one on the event sizes as well. So some public health fact sheets there. We also obviously did a lot of stuff on the economic implications of COVID-19 there. So as you walk through these, you should probably trigger some thoughts about, again, all these sort of policies that came into play that we often had sort of taken for granted before the pandemic hit there. Obviously the impact on small businesses there, unemployment claims, and then the implications that, of course, had for the capacity at the state government to process those claims. Workers, what workers were impacted most. There's a lot of data on that as well. And then, of course, recovery, when we started to see that, which metros were faring better in the recovery there. The PPP programs, right? The impact on the low-income workforce as well. And then, of course, the debate over opening schools. There is also some work done on housing, of course, and this is an issue that has continued to resonate post-pandemic there. The impact on childcare, another issue that we're still working through. Higher education in the Mountain West there, what was the implications of that in terms of both the budget there, the employment data, creative class jobs, lots of them. And then, of course, the issues associated with incarceration during the pandemic, right? Work from home, right? And then, of course, the recovery in the Mountain West here. So as you can see, lots and lots of issues were impacted by COVID here. This, of course, is not exhausted. There was other things that we didn't cover. Certainly the impact on politics, social and public engagement, and of course the issues associated with return to work there. There is, of course, one big issue that didn't get a lot of attention during the pandemic, and that was, of course, leadership. Right? The people who were tasked with overseeing the response and the recovery here. And that's what I think makes this project so important and so unique, that we essentially hear from the leaders who are in real time. We're having to adjust their organizations, make big decisions, often under very, very tight timelines with little or no information or contradictory information as they move forward there. So what we see here in the project, as Kellyanne and Magdalena will talk about, is you'll hear through these voices what it was like to be a leader of an organization during that there. This project also has some slightly different deliverables for us, right? Usually we do a lot of fact sheets, a lot of descriptive data here. This will have a podcast with interviews of that. There will also be an archive, an oral history archive of all these interviews will be over in the library there. And of course, these data will be mined by the team as well as others moving forward for a lot of more academic work on that as well. So there'll be a website that's up, and you can access that through the Lincy Institute and see all the various deliverables associated with this as well. Before I hand it over, I want to say a couple of thank yous. First to UNLV TV. If I think I did my math right, this is about the 150th event they've done for us over the 15 years, so between Brookings Mountain West and the Lincy Institute. So those are all available online, so these will live in posterity forever. On that one there. I also want to thank our donors who provide us with the autonomy and the resources to support this type of research. I want to give a shout out to Ashley and Caitlin for all their work on this event, including the art for this as well. And a couple of reminders. On Friday, we will have another event, another community forum here, and we will be hosting that. And that will focus on mental health initiatives being developed by UNLV faculty. And again, that was one of the big outcomes, as they'll talk about, of the pandemic, was just the attention to mental health. So this will give us a chance to look at what UNLV is doing there. And then next Tuesday, we'll have our last Brookings Scholar Lecture for the year. Catherine Meyer will be her first time in Las Vegas, and she'll be coming out and talking a little bit about research on inequalities in higher education. So if you're available on Tuesday, but of course they will be recorded and you can watch them on the web. So without further ado, I will turn it over to the stars of the show, Drs. Kellyanne Beavers and Magdalena Martinez.
Mike. Hello, everyone. Thank you for coming today. Really appreciate your presence today. My name is Magdalena Martinez. I'm an associate professor at Rowan University in New Jersey, previously at the University of Nevada, Las Vegas. So excited to be back with you and joined by my colleague, Kellyanne Beavers, who I've had the pleasure and delight to work with for the last 3 years. Thank you, Lincy Institute, David Demore, for allowing us to really take this project on. As David mentioned, there were a lot of descriptive statistics, and every day we were bombarded during the pandemic of what was going on all around us. But we weren't hearing much about what this meant for us as a community, right? For the leaders leading some of the key organizations in our region. Kellyanne and I have had many conversations about this, and I couldn't have asked for a more compassionate, capable, engaging, and thoughtful partner for this project. There are some people here that we'd also like to acknowledge. Taylor Cummings, who was one of our graduate students very early on, and Carmen Solano, who is now in New York City pursuing her PhD, and many, many undergraduate students who we've all acknowledged online in any publications that we've engaged in. But the truth of the matter is that we didn't know how to make sense of what was going on. Right? We didn't know we knew the numbers, but there was a level that we just didn't know how to make sense of as we saw our friends and family and neighbors die, right? Disproportionately affecting our communities of color. The mobilization of public health and economic resources. I mean, we're still trying to wrap our minds around that and figure out, what did we do right? What could we have done differently, right? And certainly we have great databases by many national organizations and maybe even local ones that let us know where this money went, where that money went. But we all know that those types of decisions are essentially a manifestation of our values and what we care about. Am I right? Same thing with public policy, right? It's a manifestation of what we care about as a society. And so that's what we're here to talk about a little bit more, because we learned so much from all of you, and many of you in here were interviewed during this time. We, of course, Nevada experienced one of the highest unemployment rates in the country, but we're no stranger to that, right? Everyone likes to say, well, Nevada's different because we know how to make something out of nothing. Look at the 4 miles on the Strip. We know how to bounce back up, but this was different. Kellyanne?
One of the aspects that we observed that was different was that leadership evolved in the sense that leaders emerged from within organizations, and leadership was distributed down and throughout organizations. So it went beyond the established hierarchies, established roles, the usual lines of communication, and became a really horizontal and thoroughly distributed opportunity. And this allowed many people to step into their power in a way that they might not have otherwise or previously. But not for nothing, to have to act out of necessity in a decisive and swift way and respond to challenges that, as we heard from the interviewees, because this entire presentation is intended to be truly what we learned from the stories that we heard and not our own thoughts about it. And what we heard from them was that there was plenty of time in which they truly didn't know what to do, and yet had to do anyways, and then talked with us about how they made those decisions anyway in the face of so much unknown. This altered the way organizations learned, and it just has really been an incredibly humbling and meaningful opportunity to be able to listen and learn from people. And the last thing I want to add before we move into the rest of the presentation is that this also altered my perspective on learning, in the sense that nothing that we heard from people, it's not in a book, it's not on the internet, you can't find it in the news. The only way I could have captured and interpreted the level of just grief and intensity and experience that happened was to talk to people. And so I think embracing the value of that and having sort of the courage to listen and cross boundaries where you might not have previously as we go forward is going to be a big part of how we all grow as a community.
And that's essentially our rationale, right, of why we decided to embark upon this project. And I love this picture here, because when did we ever think we'd see the Strip like this? Completely empty. Do y'all remember people riding their bikes on the Strip? I mean, when did we think we would see that, right? So what did that mean for the organizations that help and make this community go? Well, now, before we get into the fun stuff, of course, a word about methodology, because at the end of the day, we are at a university, we are academics, and we want to make sure that we share with all of you that essentially our overarching focus, qualitative research, that's what we did, was to really understand the Nevada experience and how people and organizations responded to the impacts of COVID-19, right? And so there's additional detail, but essentially what we wanted to do in terms of who we interviewed is we wanted to go to the top, right? We wanted to talk to the governor, which we did, Governor Sisolak. We wanted to talk to the people in the governor's office, which we did, Michael Brown, he'll be with us in a little bit. And we wanted to talk to individuals running our school districts, because those were not controversial spaces at all. Everything was fine, peaceful, for K-12 and higher education. Everyone just was, complied with everything that was required. And so we wanted to hear from the superintendents and how it differed from Elko in Southern Nevada, and how it differed at the state level, right? People trying to hold everything together, right, Joan? And we wanted to hear from our public and private institutions. So we'll go through a couple of slides so you can really get the breadth of the organizations that we interviewed. And essentially, our interviews were pretty simple, right? We academics love to complicate things, right, Ryan? We love to complicate them. And so we just said, what happened? Tell us what happened. What was hard? What worked? And how can we prepare better? That was it, right? That was it. But we gained a lot more than we thought we ever would. The analysis, of course, we met as a team. We talked about what we were hearing. We tried to make sense of it by coding and using fancy qualitative research software program and so on and so forth. But at the end of the day, it was going back to the interviewees and saying, hey, can you read your transcript? Did we capture this? Right? And mirroring some of what we were hearing. And so who did we interview? We had some broad categories defined. We wanted to know how the organizations that were at the forefront, right? Delivering food, providing shelter, worried about people that couldn't get to medical appointments. And so we reached out to folks and we said, who else can we talk to? And then we asked the same question over and over again. So here are some examples of the organizations that we spoke to that were primarily nonprofit and focused on either trying to deliver the services or convening the philanthropists, right, that would provide that funding. And we know that in Nevada, we provide a significant share of our social services through philanthropic efforts. We won't discuss that, if that's good or bad, but we have some opinions here, right? And then the private business and industry. We wanted to know what the folks were thinking. All of a sudden, it wasn't about ROI, right? It was about humanity. It was about ensuring that we could continue to build those bridges or build new bridges where they didn't exist in the past when it came to private organizations and public organizations and philanthropy, right? So this is a sample of some of the organizations that we spoke to. In total, we interviewed about 17 individuals within the private business and industry. And again, we were looking at speaking to the CEOs, to the folks that were really making decisions and working at much higher levels. K-12 to higher education, we interviewed 16 individuals. And again, this included presidents, superintendents, executive officers. And so that's a sample of our K-16 folks. And finally, elected officials in local government, right? Everyone, as I said, from the governor to the governor, people in the governor's office, commissioners, mayors, regents, trustees, so on and so forth, right? Along with those municipalities and public organizations that help run our society, right, in our community. So what we're going to share with you here in the next 10 to 15 minutes is the categories and themes that we observed, right? And it revolves around three areas. Regional governance, right? This is such a fun word. We love governance here at the Lincy Institute. And we know that you all have some great reflections on that as well. And again, governance is critically important, right? To make sure that we're able to do what we need to do. And this idea of collective leadership, and Kellyanne alluded to some of this, that it wasn't so much assigned leadership or, one person that was at the top of the organization that had to make the decisions, but rather we saw this collective leadership come together in ways that had not in the past. And the critical importance of communication, right? And specifically authentic communication. Because if we can recall that politically, nationally, it was not the best of times also, right? We were getting mixed messages every day, right? And so how do you build trust with people that you're unable to interface in meaningful ways? So what Kellyanne will do next is discuss the specific categories and some of the themes that emerged and some of the challenges that we'd like you to consider as a part of this presentation.
Thank you. So, as you all know, coordinating within a network is only one level of change. Coordinating across networks systematically, sector to sector, is another. Consider specifically how our business community supports our government during a crisis response or outside of a crisis time. Consider how our local governments could receive information from our nonprofits as they work toward regional goals and interface with all the jurisdictions versus having to communicate independently. These considerations of how networks coordinate not only within themselves but with others came abruptly into light with the onslaught of the pandemic, and particularly at the peak of the pandemic. And so where there were trusting relationships established, there were open lines of communications between sectors, and where they weren't, folks had to learn and improvise very swiftly, and I commend the many organizations who shared with us what they chose to do during this time. The word capacity, when we talk about how to grow the capacity of these systems, is used intentionally to mean what the system is capable of. A high capacity system can function under immense pressure without collapsing. And this is not by accident, it is rather by design, ensuring that the system is not overly reliant on any one part of the system, but rather is opening lines of communication so that there's a shared capability if anyone is overloaded that can be better distributed. Part of our ability to do this going forward, as Magda spoke about, has to do with building the trust to be able to say if something isn't working. Now, during the height of the pandemic, hemming and hawing about what wasn't working wasn't the highest priority. But at this point, when we do have the capability to look back and to look at where we're going and be reflective about what is possible, I think it is worth thinking about how we slow down and become willing to get into the weeds with one another across sectors and talk about what others may not understand because they are not working specifically in the same wheelhouses, and find ways to bridge those conversations. With that, I want to move toward talking about collaboration, which is frequently touted as a solution to all things. If we just collaborate more, everything will be okay. Collaborate and it will be great. And I think it's important to acknowledge, and we heard from the interviewees, that collaboration can also be discouraging. It's not always effective. It can be time consuming. It can lack focus. It can cause confusion or result in delegated responsibilities that can be unclear or burdensome. And when that happens, it discourages folks from working together. During the pandemic, there was no time for focusing on that. Action had to happen, and people were in awe of what did happen and what we were capable of and the ways we did work together, and the pace of how things were made to happen that it exceeded what they thought they had been capable of prior to that. For example, in Northern Nevada, there was a plan to there was a shelter that had 250 beds, and there was a goal to grow that shelter over the course of multiple years. But this was prior to the pandemic. They had a 5-year plan to grow that shelter to 800 beds. During the pandemic, they did that in 9 months. And here in Southern Nevada, the capability of our housing field professionals and those who work to support those who were unhoused was put housing on the map in a new way. We all began to recognize that the level of desperation was high, obviously, but also that we were all innocent to this. And so it was possible to see individuals in the community as innocent and deserving of help in a new way that we might not have been willing to approach prior to this. And I think looking back on that and embracing it and seeing what we can do with that now is really important. One more thing I want to say before I move forward is that if you've ever been to therapy or even scrolled through Instagram to look at self-care memes, you probably heard that changing your belief system and looking at your core beliefs is really important to changing your life. And I want to encourage you, especially now that some time has passed, to recognize and commend yourselves for the fact that we have the proof now that Nevada can do things faster, they can do things in a new way. It happened. I am not pretending that everything was perfect during this time. We all know that it wasn't, but each of you has been a part of, and all of our interviewees were part of things they never expected to be possible. And so looking at what your beliefs are about what is possible and how that lines up with what happened, again, it has the potential to change your life and change the lives of our community. So with that, I will just close by saying on this slide that increasing capacity is both harder than it seems, harder than it sounds, and simpler than we'd like to believe. We have to start where we are, use what we have, and do what we can. And from there are a host of appropriate next steps, such as asset mapping and needs analysis and crossing communication barriers to continue to move forward and lead together in the way that we have historically that are available to us and that our interviewees articulated, hoping would be carried forward. The next theme that emerged, as Magda mentioned, was collective leadership and civic capacity. So before I get into discussing what we learned about that, let's talk about what I mean by those words, which is the idea that leadership isn't something that an individual embodies and other people follow them around. Rather, that leadership is a quality that is called for throughout the community and can be developed in such a way that allows our civic capacity to expand. And that has unfolded during this crisis, specifically as people embraced their altruism in a way that they might not have otherwise and began to take steps to support one another and make things possible that had not been possible prior. We all know that the pandemic brought attention to mental health. It also destigmatized mental health. I was speaking with a mayor who told me that she'd always been a huge advocate of mental health, but had never talked about it openly as part of her platform until the pandemic, when her sister was dying of cancer and ultimately did pass away, and then her brother passed away of what she understood to be probably a drug overdose. At that time, she realized she needed help and reached out to ask for it and learned that she did not tell them who she was when she reached out, and learned that they could get her in like 3 to 4 weeks. So as she realized this, her heart opened in a way to the challenges of the community, right? If she's ready to fall apart, what's happening in her community? And she was able to take the steps to dedicate some of the CARES Act funding, about $1.3 million, to buy subscriptions for residents to use Talkspace. So over 200,000 residents, in this case in Reno, were able to access this mental health care support, which obviously was something unprecedented. I know that word is like probably getting watered down as we all continue to say it, but still, I think realizing that there is not an answer for everything and that we do need help to be mentally clear at times is something that has really evolved, and that I think we can take forward as we think about how to develop attributes like compassion and humility in the people who we work with and lead. And the humility that was revealed to us through these interviews, the transparency of leaders and their willingness to reveal that, as I said at the beginning, that there were plenty of times that they truly did not know what to do, has allowed us to think really differently about how what leadership is and how we help support our leaders. When I think about the fact that an established leader truly didn't know what to do at that time, what happens inside me is I realize I need to help. I need to step into myself and see what role I can play. And that happened throughout our whole community as we all realized that no one had a magic wand to fix this, and we were all going to need to contribute how we could. Renewal mindset is something that we learned about actually through literature published by the dean of this college, Dean Ulmer, who writes about the fact that in crisis communication, oftentimes leaders after the response are hoping to revert back to the way things were before, to get their organizations back to the way they were before and to preserve their image and their reputation, whereas a renewal mindset is about creating a new vision and acknowledging that things won't be the same and moving toward that and honoring it and making room for the people in your organization to feel and process what they need to in order to truly grow. Failure as a part of organizational learning is also one piece of this picture that I wanted to talk a bit about. And I think I will combine that with my authentic communication information because there's overlap there. So one thing that we learned and heard, quote unquote, was that leadership had nowhere to hide during this time. And this created a circumstance where, again, leaders had to acknowledge that things were not ever going to be the way they were. They might not have known what to do, but there was a distinction between leaders who were willing to take action in that moment and leaders who were like trying to make their way to the back of the wall and get out of the limelight. And I don't blame them, because with execution comes accountability. It's hard to be under the level of scrutiny that many leaders are under in making these kinds of decisions. So what we found and heard from the folks we interviewed was that leadership that allowed the individuals in the organizations to be liberated from the fear of failure worked at this time. If they already had a culture that it was okay to do things that didn't work and you just didn't do that thing again if it didn't work, then the wheels turned. If they had a culture where people didn't feel they had the permission or freedom to make a decision and that they didn't know if they were trusted to move forward, things stagnated. So that's something to keep in mind as we learn from our mistakes and realize that we think, again, it's about belief systems. It's not how it's always been, it's how it could be and what we work together to make possible. This is something that, as we think about this, and we think about something like authentic communication, again, authenticity is one of those words that's kind of getting pushed at us a lot as something that we should all aspire to, and we know what it means, but how to put it into practice is a whole nother question. What you do to be authentic is sort of specific to the individual. And one of the things that we learned that people felt was authentic when they worked through this time was when leaders were able to be transparent and honest. And that's really scary when that's aligned with the things that we were hearing about how things weren't clear and leaders didn't know what to do, and being honest about that is not always easy. But we did find that in spaces where people were honest and there was not consensus possible, innovation happened. Even when people moved forward with decisions that isolated other people and amplified inequity and distrust, the cities and the nonprofits and the business community, many people chose to create alternative solutions. For example, the schools that were established in City of North Las Vegas and City of Henderson to support people who worked for the city, and then in some cases people who worked outside the city who were essential in responding so that the children were able to go to school at times when the schools were closed. This was a way to do something different in spite of the fact that there wasn't consensus about what should happen with schools, and we all recognize that was a very complicated issue. The last thing I want to speak to is that the pandemic heightened an evaluation of our purpose, values, and beliefs. And as we take steps to rise above the stories we're familiar with about what hasn't worked and why, I would encourage you to think about something several leaders talked to me about, which was the science of hope. And hope I am familiar with, but the science of hope was another thing. And I have looked into it since, and I don't know if you guys know, but the City of Las Vegas recently did, and the City of Reno was the first to join what's called the Hopeful Cities Initiative. And in any case, both that initiative and some other work articulates how there is proven science that teaching hope and committing to communicating and instilling practices that allow children and adults to continue to be hopeful has very specific measurable impacts over time. So I think that's something we can continue to reflect on as we work to rebuild trust throughout our diverse communities.
Thank you, Kellyanne. And now, for those of you sitting there saying, well, that was a lot of information, and I think I'll remember one thing, worry not. Worry not, because we do have a forthcoming brief that really unpacks these themes, and we provide exemplars from our interviewees in terms of what we observed based on that particular theme. And in fact, as Dave Damore mentioned earlier, we have been busy doing some other things. As academics, we love to go to conferences. As professionals, we love to go to conferences, especially those in Hawaii or any beach community. These, sadly, were not in a beach community. As you can see, St. Louis, the exciting city of St. Louis, and Minneapolis. San Francisco is pretty cool, and Nashville. So what we have done is shared with some of our colleagues, right, in more academic ways where we outline theories and, methods and all that. So we have specifically I presented recently on Hispanic serving institutions, which the state of Nevada, FYI, has pretty much the most. I don't believe there's any other state that has that all of their institutions are either emerging or Hispanic serving institutions. So looking at leadership from the university and college presidents, as well as other focus in housing and collaboration. So this that we covered today will be a forthcoming brief, which we will share with all of you, and the special collections, of course, is available. Every interview will be available for generations to come, and the podcast. So what we're going to do now is proceed to really the best part of the program, and that is to hear from some of our interviewees. And before I start to introduce our guests today that will be on the panel, I would like to acknowledge some of the individuals that were our interviewees. Kelly from the Clark County School District, I apologize, last name, I did not write it down. We're on first name terms. That's right. That's just the way it is. Who is? Just Kelly. Just Kelly. That sounds great. I think that should be your website. Michelle Merced is with us too. Thank you. It was a great interviewing you. Virginia Valentine from the Resorts Association. Jenna Wilcox, a dear friend. So good to see you from Project 180. And Joan Ebert, the superintendent for the state of Nevada. Easiest job. Highly recommended. And did I miss anyone?
Our panelists.
Our panelist, yes. All right, so as we are transitioning and the wonderful folks here in media bring out the chairs, the very comfortable high chairs that we will be sitting for about 50 minutes. I would like to introduce Michael Brown, who needs no introduction, right? He is a fellow with the Lincy Institute and a Nevada business leader. Mr. Brown has held 2 cabinet positions in the administration of Governor Steve Sisolak. He was, of course, the first director of the Department of Business and Industry, and then the executive director of the Governor's Office of Economic Development. Thank you, Michael, for being with us today. And we also have with us today Fuilala. I was so excited to pronounce that name, Riley, because I'm using my Espanol, Fuilala, who is the president and CEO of Help of Southern Nevada. Many of you, if you don't know her personally, you certainly know of her work. During the height of the COVID pandemic, Ms. Riley stepped up in a major way, and under her direction, at Help of Southern Nevada brought an additional 400 beds for homeless individuals and families, paid for over 3,400 months of rental and utility assistance for those affected, and created an additional 30 jobs within the nonprofit. And I suspect that over the course of our conversation, she will share how her organization has evolved and changed. And when she started as an events and development manager and wore many, many other hats, has seen the organization, just like we've seen this region, grow by leaps and bounds. Dr. Ryan Juden needs no introduction. He was a city manager of the city of North Las Vegas from 2018 to 2024. I believe today is probably your last day, am I right? Oh, 3 weeks, you're still the city manager. Wonderful, okay, they were able to keep you for another 3 weeks. Of course, Ryan joined the city of North Las Vegas during an unprecedented period of financial and political crises. And under his leadership, a comprehensive plan with operational and organizational changes was implemented to restructure the city government, which no doubt had an ability to respond to the crisis of COVID-19. So that work that we all did We had no idea how it would manifest itself and how it would provide capacity for our organizations, but we certainly did have to experience that. And finally, but not least, is Janet Quintero, who I have known since, my gosh, she was a freshman in high school, and I still think of her as a freshman in high school. Where are you, Janet? There you are. Is the Vice President of External Affairs of United Way of Southern Nevada. And her dedication and passion for creating positive changes has led her to spearhead the organization's advocacy, public policy, and community relation efforts. So please join me, please. Yes, applause, applause. See here, where is her? Anywhere you like. So I have some questions here today that I'm hoping we can engage as a group, and then individual questions based on some of the interviews that we conducted over the course of 3 years. And I want to start by asking you all, we heard about the role of governance and the role of leadership. If you can all briefly talk about and extend perhaps some of the themes that Kellyanne identified, and that will be hopefully unpacked in the brief. The role of governance and leadership in times of crisis. What are the key lessons from your perspective on what we did right navigating the COVID-19 pandemic?
I'm all tied up.
Okay.
Do you need help?
No, I don't.
Arm bandage?
See, I can like put it in there.
Okay, there you go.
Janet, I think you have something to say about that.
Sure, yeah, I'll get it started. Can you all hear me okay? What we did right. I think we did a lot right. So I've worked at United Way of Southern Nevada for 5 years, and I started with an entry-level position. Not shortly after my freshman year in high school. But I really learned nonprofit through that experience, and what I learned not only from the leadership and the governance at nonprofits, but just overall is that you have to listen to people who don't hold influence and who don't hold that power. And I have to say that I'm really grateful that I landed in a place that really acknowledged and heard me when I said, hey, we're getting calls every day from people who don't speak English, and they're charging them for COVID vaccines, or they're paying for COVID vaccines. So I think that listening to someone who was new to nonprofit, who was new to even in their professional career, but really listening and saying, hey, I think there's something there. I think I've experienced that during COVID, and I'm really grateful to say, and I see many leaders here in the audience, that I've had really honest conversations with you all, and you've all been very open to listening to what I have to say, not only because of my title, but because we're authentic.
Mm-hmm. Thank you, Janet.
We prioritized public health over economic affairs. The governor had to make the very difficult decision on March 17th to close the Strip and everything else. It was just a week after the nation had declared that this was a pandemic. We had not had a pandemic in modern collective history. The 1918 pandemic was out of people's memory. And so it was very, very important to get people, unfortunately, out of their comfort zone to understand that this was a crisis.
Yes.
I would say that a couple of things that we did right was the readily available funding, be it through those 2 stimulus packages of CARES and ARP. And then the government funders for us created a shortcut, less red tape, less bureaucracy to get us the money so we could spend it. And that was really important. And then especially when we went back to the regular contracting and negotiating of contracts and funding and negotiating whether we get upfront funds, that returned recently. And so that was a very stark reminder of, that was cool when we had COVID money, and they were literally creating opportunities to wire us the money ahead of time so we wouldn't be bear the burden of cash flow of that government reimbursement. So I think those two things were really, really important for us to be able to impact our community quicker. And so kudos to that, and we'd love that to come back.
So I'll speak for North Las Vegas specifically. I think one of the things that we did right, and you talked about it when you're in the intro to my bio, is as an organization, because we had faced the financial crisis that we had, we were very primed for crisis. So our team was acclimated to what it took. And I remember sitting around the table on the 14th of March with all the different leaders. Some of them were here at the county building, and the shock in some people's faces where I'm thinking, oh, well, we've got this. Like we did, we faced much bigger challenges and we were able to address them. And I think that showed itself. I remember that the next Monday after I had suspended all the union contracts on Sunday, where we sat around and we decided a lot of organizations were making these determinations of essential and non-essential. And we said, you know what? In a pandemic, everyone's essential. Maybe your library is going to be closed, or maybe your after-school programs aren't going to happen, but the residents need all hands on deck when it came to government. And I think we did that well in North Las Vegas, and I'd say regionally, we did that really well. We were coordinated, working together. They had all these acronyms. It felt like you were in NASA sometimes. They had the MAC and this, but I felt that it was done really well. I mean, Commissioner Kirkpatrick was instrumental in leading that. I found all kinds of new ways to say the F word, but she was very provided strong leadership during that time, and I think we did that really well regionally.
Ryan, I'm glad you brought up the MAC. Right, and I'm not sure if everyone in our audience is familiar with the MAC, the Multi-Agency Coordination Committee. And we also interviewed Commissioner Kirkpatrick, and Kellyanne and I were really just, I don't know if impressed is the right word, but just really humbled by the work that took place as part of the MAC. Now, I understand that there are rules and regulations and expectations for a MAC. But I think something different happened here, that people traditionally that weren't at the table were invited to be at the table. Can someone talk about the role of the MAC and how that manifested during the early stages and then later?
I was probably the only one in it, so lucky y'all. It was right away. It was on the 13th, actually it was the 12th of March. I think the federal declaration was on the 13th of March. Friday the 13th, anytime the federal government's gonna make a declaration, it's probably gonna really be lame. And so we were meeting from that time all the way through. We continually met, and it was very intense in the very beginning. I remember that second meeting on the 13th when Mesquite was there, and Mesquite's like, well, we got to go back. And Commissioner Kirkpatrick's like, well, you need to have your people bring you some clothes because you're not leaving. Like, you're not leaving. We are going to all work on this, and it's going to be a 24/7 type thing. And it very much was. And you had all leadership from, private sector, public sector. It was, I would know no different because it was the first time I was in a MAC, but I do recognize that it was expanded out to make sure that we had stakeholders there. And I think in the very beginning, the problem the government has is we're very good planners, but we're not the best executors. And so what you had is you had a bunch of people that were very proficient planners. I have 7 planners on my payroll. I don't really know what they're planning, but they're planning stuff. And when they all got together at the table, all of a sudden they recognized, wait, we've got to be executing, and we have to execute really fast. And some are better at that than others. And I think MAC provided that forum where everybody could see what needed to be executed on, and especially some of the governments that were the entities that are less acclimated or used to executing could find comfort in the group, and we could go out and execute. And I think without that, it wouldn't have happened. They would have just planned and had the greatest plans in the world, but never executed, because execution is where accountability comes, and that's not really government's strong suit. So the MAC provided that opportunity for there to be, this kind of, we felt stronger in numbers, and people were able to execute.
Thank you for that. And while Michael, Falula, and Janet may have not been on the MAC, we did have similar type of governance structures, if you will, that evolved. And Michael, could you maybe talk a little bit more about that? And if you would also, we also interviewed Mr. Jim Murren, who was the head of the COVID-19 task force. He was appointed by Governor Sisolak.
Yeah. The governor's staff is the smallest staff of any state government in the nation. So the capacity that existed there was quite limited. And I ended up taking about a third of my staff and putting it in immediate support of the governor's office, Department of Education, and a few other agencies. That wasn't sufficient. So we turned to the private sector, and Jim Murren stepped forward and put together a group of distinguished Nevada leaders to work on the first challenge of getting adequate PPE, personal protective gear and equipment, to the state. And I was the liaison, along with Sandra Douglas Morgan, to that. And we would meet often, almost daily at some points, as we attempted to bring all of this material collected up around the world and bring it here. I don't know what we would have done without that. The state just is not as agile as local government. And we had the tyranny of distance in this huge state to cover off, 17 counties. And so the Murren Task Force was absolutely fundamental. And I think we were one of the few states to put something like that together. I've not really seen it otherwise. But, when Sheldon at Adelson 747 lands filled with PPE from Macau, that makes a huge difference. But, of course, the Las Vegas airport had no customs person to clear it. So it fell on my guy, Chris Sanchez, to work with Congressman Horsford's office to get somebody from customs to clear this so we could get it over here and deploy it in Nevada. So, the advantage of having a small state where everybody kind of at that level knew each other made it much easier, because it was like everything was on a kind of a first name basis. Right. The MAC that existed, the state emergency responders were connected to it, but the state's political structure, the governor and everything, was not connected to it. And so I built a backdoor channel to Commissioner Kirkpatrick, and we were talking regularly back and forth. And then we'd have this fellow come over to Grant Sawyer in the afternoon every day at 2 and tell us what was going on. But that was all informal, wasn't part of the formal structure.
So perhaps a limitation.
It was. The state's emergency was designed for floods. It was designed for, one-off limited duration events, a flood in Fernley, something like that. We were staring at projections of 40,000. When Governor Sisolak made that decision, we had a projection of 40,000 deaths from COVID. Now, we lost 12,000 people in COVID, which is just under the population of Boulder City.
Which doesn't make a great tagline either. We only lost 12,000, right? Yeah. But when you're at those levels, you realize it can be much worse.
Yes.
Yes.
Yeah.
And before we move on to the role of nonprofits and coordination, could you say a few things about just the interface with private industry, right? Private business and private industry. And we talked about the task force, but surely there must have been...
Communications, this was set up. Betsy Fretwell helped us through Switches technology. We were able to put together an information system where every Friday at about 3 o'clock, I could talk to all the leaders of every trade association in the state, a group of nonprofits that were part of it, 3 Square and others, and just kind of tell them what was going on. It was a half-hour call, tell them what I knew, took questions from them, tried to get them answers. We kind of put that together, and like I say, it was every Friday at 3 o'clock. So.
And one of the things that we also learned about through Commissioner Kirkpatrick was the COVID hotel, right? The COVID hotel, anyone familiar with that? Where it was actually, people were taken to quarantine, right? Yeah. Who would not want to quarantine in a Las Vegas resort? But of course, those weren't the type of things that you broadcasted because there was so much so much trauma and tragedy taking place. And that's where nonprofits come into play, right? So there really wasn't an infrastructure of sorts, right, Janet? Tell me what your role was during that time to help bridge that.
Yeah, and it kind of relates to the PPE or the personal protection equipment. I remember one of the first few things that happened in March is that we convened a call in Puna Mather. She called on United Way, and they said, we need to convene everyone. We need to see what's going on. We're essential workers. You have nonprofits that are providing direct services in the community. And I remember we tried doing that over a literal conference call. And everyone called in, and we had no idea who was speaking, and it was chaos, but that was before we knew Zoom, right, and the capability. So we really tried to have a conference call. That didn't work, but we realized we need something like this. We need to be in constant communication. We need to coordinate. So someone figured out Zoom, right, and we sent out the link. And I remember joining that first call, and you had close to 100 nonprofits, 200 nonprofits who joined. And we just wanted to see what everyone else was doing. We just wanted to see who had the resources, who was on the ground, who was doing food delivery. So from there, we began meeting, I believe, weekly, and that became what we know as a nonprofit sector call, the Nonprofit Sector Connection that we still host monthly. At first, it was very much emergency management, and we had someone from Clark County Emergency Management join our calls very regularly. They had a standing agenda item, and if you're familiar with our Boyd room, that was filled with face masks. And we were able to deliver that equipment directly to nonprofits. So that was something that evolved quickly after the emergency, the COVID-19 emergency was announced. But I realized that in that way, we played an important role in getting those masks and equipment to nonprofits who were in the community, who never left. Right, who not even when the mandate was like go home and quarantine, they were always in their community. So that's something that was designed during the pandemic, and now it's lived on after, and it has a different purpose, but we continue to meet and coordinate in that way.
Mm-hmm.
Yeah, so we were at Help Southern Nevada, we were pretty boots on the ground when it came to the quarantining of the unhoused. So if you can imagine that on any given night, there's approximately 6,000 people unhoused. So when you get the quarantine order, go home. What do those 6,000 people do, right? We don't have enough shelter beds, but shelters, obviously, there were some challenges with them because it's congregate. So we were pretty instrumental with Clark County's assistance of standing up what they call non-congregate shelters. We had not operated a non-congregate shelter before, but it was something that we needed to help with, right? So that was something, it was identified as the sickest of our unhoused, what needed to be brought in so they can be indoors. One of the things in the 3 years that we ran that non-congregate shelter was we really realized how sick our unhoused population is. On average, our team experienced a passing of a resident once a week. Some of the other challenges that they faced was there was probably going to be a domestic violence call once a week. There was probably going to be 1 or 2 CPS calls once a week. These are all folks that are unhoused, and now we're bringing them in because we need to address some of the social determinants of health, right? It was a difficult task, but we had to bring on an extra 600 beds total between some of the other programming that we had. So while most people could go home and work from home and whatnot, our team had to work overtime to serve our most vulnerable unhoused. And it was really difficult because all of us were learning. As Clark County management, we used to say we're building the ship as it's sailing, because they would get, I guess, I don't know if it's advice or like about the what is required of what the funds that they have, right? So we would have it, we'd be going, and then we'd get a call. I don't know if it was because of a MAC meeting or somebody read some regulation that just came out about the money, and then it would be like a screeching halt, a little bit of a shuffle. Okay, can we still continue to operate? So that actually happened throughout the pandemic, throughout the quarantine, and about 3 years of that.
And what we heard too, Kellyanne, and everyone here, is that kind of stop and go, having incomplete information really required us to be reflective about, wait, I have this formal role, I have this, my personal role. I don't know. I don't have all the answers. So this new sense of humility, right, and compassion, right? Now, some of you were governor's office, interacting, interfacing with business perhaps, and more government folks. And some of you are on the ground, right? Hearing from your constituents. Then this next question is about just the intersectionality of all of this. I'm an education researcher by training, and what I've come to really learn and appreciate in my years at UNLV and Lincy Institute in particular is how education policy and education outcomes is less about the child and more about all the other intersecting attributes: meaningful work, quality of life, for parents, being housed, having access to health care. And we know that education spaces were some of the most controversial, the stop and go. Could you talk about how, although that was not in your title, how you interfaced, how you collaborated with, for instance, the school district or the children that you knew were in your region? How did you help alleviate some of that, some of those negative outcomes that you knew were coming?
So a couple things. First of all, from a staff level, I can remember on Tuesday after the declaration going down to 3 Square, because schools were essentially announced they were going to be closed on that Sunday. And so we had the meeting on Monday that there were no non-essential personnel. Everything that we were closing, we were going to repurpose. We had a bunch of utility players that we could move other places. And so I remember distinctively on Tuesday going down to 3 Square with our librarians, with our parking ticket people, because we're not giving people parking tickets during a pandemic. That's the last thing you want. You don't want a parking ticket anytime, which probably some of you are going to get one out there, right, when you go out to your car. So those guys, we were all together packing lunches at 3 Square because we knew that the kids were going to not have food. Because unfortunately, schools, probably teaching kids is further down the line of what they do. Feeding kids, employing adults, like those are priorities that they have before it gets to teaching kids. So we knew that we need to kind of step into that role. So that's the first thing that we did immediately. The second thing was we had made a comment that the plan was to go digitally. All these kids were going to, just do school from home. Right. And so I made a comment that was picked up in the media that with our digital divide, that we projected anywhere between 30% to 40% of our children, that wasn't going to work for them. And how do we know that? Because for the past 3 years, every AT&T, any company would come in and they want to use our light poles for their 5G and stuff like that. And the thing that they would do is they'd always show us our digital divide, and they'd say, we will help you guys with this. If you let us exploit your public property to make money, we will help you guys with the digital divides. And even though these are different competitors, they all had the same number. So I had made this comment. I get a call from the superintendent and 2 trustees, and we're on the phone, and they're like, we take issue with your saying it's 30% of your. I said, that's what it is. How do you guys know any different? They say, well, our survey, that's not what we see. And they said a couple times, I felt like I was on Price is Right or something. I'm like, what do you mean your survey, or whatever the game show is with the survey? And they said, well, we did a survey. We emailed all the parents to find out who had the internet. And I thought, what? And I remember putting the phone back, looking at it, and I got back on, and I said, Superintendent, you might want to let your trustees know why there might be some complications with the survey. And so I got off the phone, and there was a bunch of this, well, no, it's good. I'm saying, no, it's not. If you don't have the internet, you're not going to take your survey. I don't want to explain this to you. I go down, get off the phone, go down to the mayor's office. He's meeting with another council member. And I'm like, we've got a problem. These guys, they're kind of crazy. I don't know how this is going to work. We need to really look at how, especially for our first responders, which a lot of our first responders, many times they're married and they have childcare needs. And CCSD provides that, allows them to be frontline. We need to do something. And we talked about, okay, we've got to stand up a school. And so we did that. We stood up a school. Now, there was all kinds of pushback, like you can't call it this, like there's little code words we had to use because the state didn't like certain names we used, because we were just trying to address problems. And if I had $1 for every time, we'd say, you know what, if you don't like it, send the National Guard and stop it. Like, this is what we're going to try and do, and please just work with us. And eventually we all worked on these things. So we took a very proactive role in North Las Vegas and that school was provided for our employees as well as healthcare workers. And then we went to principals in the area and said, we'd like to know your weakest links. Who are the kids that the CCSD plan is not going to work for them? Is there a way that we can get them in something that can help change their lives? And the data from it, the ASU did a study on it and showed the educational outcomes of that, where students were when they came in and where they were they left. And I think that the proof's in the pudding as far as that was a good thing that we did, but we did it just because we had to respond, and we couldn't just take this, that's not accurate, which is what they were trying to tell us from their internet survey on who has the internet.
Okay.
The one thing I would just add to that was our focus was mainly on the children that were in our housing programs. But the night before we shut down as a community, we had 40 minors that were in households that were in our housing programs. Fast forward maybe 60 days, maybe 90 days, we had 400 because families were showing up in cars. That other part, right? We had 24-hour parking lots, right? Because of the businesses and whatnot. And so we realized that there was a lot of families when folks were closing, businesses were closing their parking lots, right? Folks that were living in plain sight in the parking lots no longer had a reason to be there overnight, right? So those folks, our housing programs for families increased so much. But what we did was we listened to a lot of information that was coming out of, like Poonam was doing something, and then I think Elaine Wynn and somebody else was actually trying to get tablets to kids and whatnot. We just listened to that information that was coming our way. And it may not seem like we were listening, but we did. We tried to disseminate that information to the families. And so when it was time to, hey, have you talked to your school lately? Does the school know where you're at now or where your kids are at? So we just focused really on the 400 or so minors that were in our housing programs and any of the youth at Shannon West Homeless Youth Center that were still in school. So that's how we did it, and it was very helpful to have some of these bodies of folks that were convening and then disseminating out information with regards to the school district and how to get kids engaged in this online school and whatnot. So it was very helpful for those of you who helped with that, and we're proud of the work that we did with those 400 minors.
Thank you for that.
I had staff monitoring other states that had more resources. And when we would see something in Ohio or Michigan that we thought we could do here, then we'd bring it back and put it through our system. When I realized that INCHI, because it sits almost as a fourth branch of government, we could cascade CARES Act dollars directly to them without having to go through the very cumbersome IFC process. We went to INCHI and we funded about $10 million worth of training and equipment needs in public health and moved it through that way. It was an unconventional way to get the CARES Act dollars there faster.
Very creative.
And I'll just add that I think what I learned was that there's barriers to access no matter what the program is, and that was showcased during the pandemic. We are still not there, but I think that a lot of those conversations were had, language access, digital equity, transportation, all these are barriers, and our families are facing them every day. And the accountability doesn't only fall on public agencies, it also falls on nonprofits and the way we fund the work. So to Falala's point, as a person who works at an organization that is also a funder, we're having these conversations. What restrictions are we setting on funding that doesn't allow people who really know the answer on the best use of this funding to put it to use? And as someone who has conversations with elected officials, these are things that we continue to raise because advances are important. Otherwise, you're just blocking out a certain percentage of nonprofits or just direct service providers. So I think that for me, the theme of what I learned during the pandemic is barriers to access are real. They continue to exist, and they're not going to be addressed if we don't work together, with the public and private sector.
Yes, thank you for that. And I think, again, that I want to be sensitive to the fact that school districts, which, again, I think you mentioned, Ryan, teaching is one of the many things that they do, right? Providing access to a safe place, to food, in some cases medical attention. We certainly heard that the interventions and the approaches were very different from speaking to the superintendent at Elko School District to Clark County School District. And I also want to be sensitive to the fact that Clark County School District has become a punching bag of sorts, right, for our community because it is the 5th largest school district in the nation. Lindsay, of course, has done at least a decade of work around governance, particularly around K-12 and higher education. And so I can tell you that having spoken to many of the education folks at the school districts, that they all were concerned just as you were, right? Everyone was concerned about the well-being of children, of their families. But it is the case sometimes, you may disagree with me, that when the governance structure is not aligned with the region, perhaps, it becomes increasingly difficult to do something as simple as ensure that, how do we figure out if everyone has access to Wi-Fi, right? And so I do want to hear from some of our audience members also who represent some of these educational spaces, because I'm sure that there were disagreements, but there were probably more agreements than disagreements.
I just had an issue with their survey methods.
Right. Right.
It's also in leadership, respecting the other person's responsibilities. We're in a crisis period. My job was economy, supporting the governor's office. It was not to set education. That was Superintendent Ebert's job, and to make sure that they always have their voice is always heard, and also, that's their job. Let them do their job. Don't go into their space.
Yes, but it certainly was the case. Correct me if I'm wrong. Where there had to be stronger lines of communication. There had to be more sharing of information. Right. There had to be more collaboration and perhaps strategic type of initiatives, right? Because you've all alluded to the monies that came down, right? And Fulula says, that was great. We'll take it any time, right? And so, but you've also alluded to the fact that perhaps there wasn't the infrastructure necessary. We're looking at other states, right? How do we do this in the best way that can really maximize our investment, if you will, or really touch as many lives as we would like to? So along those lines, I'd like to ask the following question. How can we improve related to government response and coordination between the different levels of government, community, and business organizations? How do we improve that for future crises or just for future processes?
I regret that there was no briefing when I joined state government as a cabinet officer on how we handled emergencies. None whatsoever. I didn't even know there was an emergency center that I would eventually start to spend, days and days and days at. There needs to be some program for folks coming into government to kind of get that kind of briefing. We had a person on staff who was, I understood was assigned for emergency things, but no one else brought us up to speed on any of that until we were suddenly thrust upon it and had to learn it instantly.
I think structurally, listen, when our founders, when they messed up on the first Constitution in 1863 and it wasn't passed and they got it right in 64, they created a structure that purposely has state government weak. That's the way they structured it. They wanted it that way, and it's persisted through time, right? Historically, the institutions have just reinforced that original structure that exists, and I think there needs to be more investment in that. If there's going to be a top-down approach during emergencies that functions in other states, it's very difficult for the governor's office and for the state departments, which are not staffed the same ways, and they also, they're just not as large with the same budgets for them to then be pushing down to a robust county that has the people, has the resources. In fact, if you look historically, in the event of a crisis, if martial law historically was declared in Southern Nevada by the sheriff, he would have to relinquish that back to the governor. The governor doesn't even have a mechanism to pull that back, because it very much, when the state was created, not only was it a purposely designed weak state government, but it was also a very independent minded Southern Nevada that was kind of supposed to function on its own and just give us your tax dollars, right? That's the way the structure was. And during this crisis, it laid bare the fact that there just wasn't, as Mike mentioned, there wasn't a staff in the governor's office that could do that. And it's very difficult to flip that switch to all of a sudden have to be involved when we had all the knowledge, we had the resources, and they were learning as they went. There were health decisions that were made where our health district and Washoe County's district weren't even consulted. Like, these are legit doctors with real degrees that do this stuff, and it was just, everyone was trying to do the best with what they had, and some institutions, in particular state government, they had a role, but they didn't have the resources to do that role.
We lacked a facility to do a press conference.
Yeah.
We had no media room. One of our first video conferences was on Randy, the governor's scheduler, on her cell phone. We didn't have any of those kinds of resources. I looked in 1918 when the pandemic hit. The governor looked after prisons and the Indian tribes. And that was the governor's sole responsibility. Now, in 2020, the governor's got this massive federal response. We did make a decision that we were not going to fight with the Trump administration. The governor would get on a weekly call with the vice president. He'd have a list of things we needed. He would try to get the things that we needed on that list, and otherwise we were not going to engage in the politics that some of the other governors were engaged in. We were just going to try to go shopping once a week.
I would say, from the nonprofit perspective, we were able to accomplish and impact a lot because we had what I call relationship capital with our funders, right? HELP's been around for 5 decades. At that time, people had been in management positions at the government entities for a while. I've been at Help of Southern Nevada for 20 years, right? So to prepare for the next crisis, there's new management at Clark County, right? There's new leaders in different entities. I think from a nonprofit perspective, we have to prioritize getting to know our funders and our electeds and whatnot, because back then it was Tim Birch and Kevin Schiller were the ones that would call, right? And that could be literally something handled over a phone call. It's difficult to be in a crisis and pick up the phone and say, "Hi, I'm Fulala. I work at HELP. This is what we do." And so right now, that's something that we have to really work on and focus. We're all busy on the government side as well as nonprofits, but it's something that we have to prioritize because people do business with people, right? And so we have to create and strengthen that relationship capital so that there is like, "Hey, I'm going to trust you. I'm going to trust that we can work through this, and I want to be of help. But if I don't trust you, right, it's going to be a problem." And so I would say from our perspective as a nonprofit is making sure that we have that relationship capital for the next time something like this happens.
And I'll add to that I'm all for having a infrastructure to address these things in the future, but I do think trust is important because I think that nonprofits have a job. I have a job, Fulala has a job, and you have to trust as someone in the private sector, someone in the public sector, that when you speak with us, we have something to contribute to that conversation. And as much as maybe Fulala and I have that platform and that opportunity to interact with you all and even to be sitting here in front of you all, creating spaces for those smaller nonprofits. That's the one executive director and the program manager delivering very, very meaningful work. So yes, I'm all for creating an infrastructure, but I do think that we need to create trust when there's no crisis, hopefully, right?
Mm-hmm. How do we do that?
I would say first getting to know people, right? You shouldn't be introducing yourself in a crisis, especially, when they were wiring us money, fronted money, right? We were receiving millions of dollars to help spend the rental assistance, right? They had to trust that we were going to spend it the way that we were supposed to, and we're not going to get funds recaptured or anything like that, right? So they had to trust us, right? In the same sense that, okay, so you want us to do this without a contract? Is there another contract that we could just expand? Because one of the things that we have as nonprofits, we're a little more nimble than government because there is bureaucracy that they have to abide by, right? And so bureaucracy is not bad because it keeps things going where they should be going, but they're not as nimble, and so sometimes it's better to allow nonprofits to get in there. But yeah, so first and foremost is get to know people when there's not a crisis, I think, and working together, talking when there's not. We have to get some work done.
And that is an excellent observation. Of course, Michael and Ryan have also alluded to it in terms of the bureaucracy, right? And it's almost like it was built like that intentionally, right? So that change is not so abrupt. But when we need something to change quickly, we get extremely frustrated, right?
Particularly governors, the American governors, colonial governors, the American experience with colonial governors is very bad. So governors actually don't have as much authority as people think they have. It is really about their personality and their ability to project that. I think we have to realize that, it was 100 years between pandemics. I don't think it'll be 100 years before the next pandemic. And the people I know that know more about this than I do, believe that with globalization, this will happen again, probably in the lifetime of some of the people in this room. And so we need to be prepared for that. I am frustrated that some of the states that I look to for advice, like Ohio, have actually gone backwards. And they've dismantled some of their public health authority, and they've removed their governor's authority. We have not done that in Nevada, and we should continue to strengthen these institutions here. When the pandemic hit, our public health system was as it was created in the 1970s. It was designed for measles and infectious disease and limited things like that. If you had to get a test in Elko, that test got shipped back to Carson City to the state lab. We do need to make those kinds of investments, because if we're going to have a tourism-based economy, we cannot have a public health incident here. The reputational damage would be far too severe.
Yes.
I think the things you can do are twofold. I mean, you had mentioned that there was a group that was put together during the pandemic that still exists, right? We have those too. Like there were things that we put together during the pandemic that we still have that are helping us in different things. Like the city managers, we all meet together regularly. I think that those are the kinds of things that you need to keep doing. I also think that government in general, I don't consider myself a bureaucrat or a technocrat. I'm a business guy that came into North Las Vegas to solve a problem. There are times where I felt like, I'm becoming a bureaucrat, which is why I'm leaving, right? Because I'm like, wow, how did I become like this? How did I start saying no all the time? Like, I don't like no. I think that what we have to do in government is recognize the value of nonprofits and what they do. I mean, that's what I did when I worked in the White House Office of Faith-Based Community Initiatives. That's essentially what we did, is made sure that government stayed in their lanes, and nonprofits that were providing social goods or answering the social contract in some way, that they were fortified and built up. And I think that's one of the things that you can do now during this time is governments are always going to try and build their kingdoms, right? They're going to try and hire more FTEs, add more fat. And by doing that, they're getting into other people's lanes when there's other nonprofits that do a very good job of providing that program or administering that program. And the government should support them instead of replicating it.
Yes, thank you for that. And Ryan, that made me think of one of the questions that we asked all interviewees. And one of the questions was, who was the hardest hit from your perspective? And we heard Janet talk a little bit about just something basic like having our material accessible to other people, perhaps Spanish, because we do have a pretty large Latino population here. And we also know that during the pandemic, there was a racial reckoning of sorts, right? There was a lot of advocacy around Black Lives Matter, and along with that, just this rethinking, right, of our population, our current population, particularly here in Nevada, right? We're one of the most racially diverse states in the nation. We had the first all-female legislature. We have certainly one of the most racially diverse legislatures in the country as well. How do we think about some of these lessons learned and preparing for the next crisis in the context of a very racially and ethnically and generational diverse population?
I'm concerned about the decline in respect for expertise. That, you know, we had very smart people on the medical side giving advice here, and their advice is better than what you're going to find on YouTube. And so, you know, I think with all of these communities, making sure that they understand, you know, what the risks are, and in combating the falsehoods that were prevalent on social media. It was very difficult, particularly across cultural lines in a community as diverse as this. You know, getting the vaccine distributed. I think we made a mistake in that we tried to prioritize groups. We should have just opened it up. Vaccines here, you know, come today. Get it done. Not this women and children first policy where we tried to prioritize everything. So I think it's just going to be a matter of constant education, but I am concerned about the skepticism that now exists towards the experts that frankly saved us. Our highest rate of infection was October of 21. You know, if we hadn't had the vaccine in place and the PPE in place, the deaths in October 21 would have been phenomenal, and would have hit those communities the hardest, which were the hardest to communicate with, and a lot of the most skepticism.
Okay.
Which is interesting he says that, because, you know, October of, I think it was 19, was the deadliest month in U.S. history, because you had, you know, war and you had pandemic, and that was literally, that is the most, per population, that's the most deadly time. And I think that history repeats itself, right? Which is kind of what Michael said a second ago. I think what you have to do is you have to be intentional and purposeful in addressing the issues that were laid bare during the pandemic. The inequalities with healthcare outcomes with communities of color, it's clearly there. You'd have to be a fool to ignore it. So then now the question as policymakers is, okay, what are you going to do about it?
That's right.
So for example, in North Las Vegas, what we've done is we've, you know, in fact, we're working with UNLV and partnering with President Whitfield on ideas of how we can use a municipal government that does, you know, land use policy, building codes, all those different things, and how can we rethink the way that looking at building codes, looking at everything that goes into community from, does it increase healthcare outcomes? If you look at it through that lens, in a minority-majority city, and we've bought back 130 plus acres beside the VA hospital, where we're going to use it as an applied laboratory to really look at, this is the design, this is the hope of what we can do, is start looking at policies and how, instead of relying on the traditional way that healthcare is done, it's trying to change our minds. Eat this, don't eat that. Do this, don't do that. And that definitely doesn't work as you're looking at healthcare outcomes through all different populations in our country. And so we're looking at how can we use the environment and changing the environment, which is what you see in blue zones. How can we take the environment from a policy standpoint to make the environment something that's increasing healthcare outcomes? So I think you have to take the lessons from the pandemic and not be scared. The worst thing that you can say, and one of my counterparts in another organization said in the newspaper during a budget presentation, like, we're almost back to normal. And I brought that in that day. It was in the paper, front page. I put it down on the table with all of my directors, and I said, this is not us. If we don't learn from the pandemic, we're crazy. Like we had a wonderful opportunity, not a horrible opportunity, right? But there was an opportunity to learn things, and you shouldn't go back to the business as usual.
Right.
If we go back to business as usual, then we will not be prepared for the next time.
Thank you. Any other thoughts around that?
My only thought would be, we had those really cool online or by phone to make your appointment, so they could control traffic. What we found was our team was having to make appointments for people because they didn't have the smart device that could do that, right? So there were people that still, as we were trying to limit them coming into the office and whatnot, there were still people that I don't know how to scan my paperwork to you, right? I can't make that appointment because my phone is a flip phone, right? So I would say not necessarily ethnic groups, but for us, it was those folks that are 0 to 30% of area median income that have access issues. So I understand how it was very cool for me and my team, I'm going to go get my vaccine and whatnot. But, when you have 1,400 people in housing, many of them scattered sites, you have to figure out how to get them to those areas. So we had to work with the Southern Nevada Health District to talk about like the unhoused. How do they get vaccinated? How do folks in lower economic neighborhoods gain access and like even just make an appointment? So I would say that was a challenge, and if we could figure that out, I mean, maybe the role of nonprofits is to do that in the next crisis. But there are folks in our community that don't have smartphones, and so all this electronic, make your appointment, make sure you're 6 feet apart, all of that is still an issue for folks that use public transportation, don't have a smartphone, and probably won't be able to afford one until they reintegrate back into the general community.
I learned there was a place for empathy also. I mean, it was important for the governor to come forward and to unvarnish truth at the front end. This is their situation. But at the other end, we got $120 million for the state treasurer and I to distribute to small businesses in relief grants. And we were concerned about fraud. So the treasurer and I don't know what we were thinking at the moment, decided we were personally going to look at each application and make sure that that business was real. And so if it was the Chicken Shack on Maryland, that was pretty easy. But if it was just the Acme LLC, it was like, oh, who is this? And so we phoned them. Zach Conner and I phoned hundreds and hundreds of small businesses, which for many of them was the first contact they had actually had with anybody in government. And the stories we heard and just kind of being there to listen to them. There was this small business, they made props for a cirque, and they were about to lose their van that they used to deliver all the props, and the $10,000 grant was the difference to their business staying open and closing. And they started to cry on the phone when I called them that day. So just projecting empathy, I realized, was much more important than I thought of at the front end.
Thank you for that. And I'd like to ask you one more question before we open it up to the audience, and that is, as a leader of your organization and within our community, how did COVID-19 change your leadership approach? Your leadership approach.
I've become more of a coach than a follow me, this is where we're going. It's more of trying to coach a team to where they need to be.
Okay.
Flexibility. We were building the ship quite often while it was out to sail. Not setting like, oh, there's the plan, now we're going. Being able to, oh, plans changed today, and understanding it might change tomorrow as well, right? And then just listening to my team. One of the things Southern Nevada experienced during that was the who helps the helpers, right? We lost staffers in 20 and 21 for complications due to COVID-19. And we had some mental health issues on our teams. And that I still get emotional thinking about them, but they were frontline employees. They wouldn't go home, to quarantine when they had caseloads to manage. And so for me, that was really something like, how's the team doing? You know, understanding that our behavioral health director basically became the staff behavioral health professional, because we had 200 plus employees that were scared themselves, but still came to work. And so I think that's probably the biggest thing that I learned, was listen to the team.
Yeah, mine was similar. I mean, not a whole lot of people know, but I had resigned from my position as city manager. I was waiting to get the tentative budget approved, which was in April, and the final budget approved in June. So we were working through the process of, internally dealing with that, and then this thing happens. And right away, I was kind of like, well, because I'm kind of a Rubik's Cube guy. I thought, well, this will be interesting. And then as it really started to magnitude of it in the first couple of weeks, I remember talking to my wife saying, babe, I don't see how I can leave. And I originally committed to North Las Vegas for 1 year, which she calls like the longest year of our life, because it's been 11. And she goes, oh, here we go again. I go, no, there's just something more to this. And so as a leader who, in the beginning of my tenure in North Las Vegas, it was very particular in, we had very nuanced things that we had to do dealing with bonding markets and different things that were not normal local government. And Sandra Douglas Morgan, our team was very nimble, and we had specific things to do. And for me, the pandemic changed me as a leader, because I realized that I needed to communicate things better. Because early on, I couldn't communicate some of the stuff we were working on. But in this, communication was key, because I would leave some of these meetings, which everyone considered like that's where everything was being done, like we were talking to God or something. And I would come back and they'd be like, what's going on? Like, is this closing? Is that happening? And so I started a daily email to our team that lasted for over a year. And it was every day, every single day. And I got more feedback from that. And as a leader, I realized the importance of just communication and how that opens up and how it made everybody feel comfortable and understand what was going on in a very a space where everyone was very uncomfortable because of all the changes that were happening.
Right. Yes.
I learned that if my opinion is different than that of everyone else in the room, that's an asset. And I've learned to present it as an asset. It doesn't have to be confrontational. I think that sometimes we're taught that, if you don't agree, or if everyone's in agreement and there's consensus and you're like, no, it doesn't have to be. And I think that I've learned to be comfortable in that and look for spaces where maybe, I don't share that same opinion. It's allowed me to grow my mindset, but it's also allowed me to share where I'm coming from. And then the next stage is, my personal story. I'm an immigrant myself. English is my second language, and I can identify with that, but I'm learning how to provide adequate ASL services, something that I've never done in my life. And now I'm like, if people don't show up to this space, is it because, to your point about the survey, about the internet survey, if people are not showing up to your space, is it because they don't feel welcomed or because you're not actively reaching out? So that's something that came from a pandemic, and it really changed the way I lead, and it changed the way that I communicate with my leaders.
Thank you for that. And I am wrapping up just 6 minutes early. For those of you that know me, I like to stick to my time because I would like to hear from the audience. I would like to hear your questions, perhaps on one of the topics that we covered, perhaps on a topic we have not covered. Perhaps you're an interviewee and would like to add to one of the things that we have discussed so far. And I think do we have a mic for, oh, thank you, Caitlin. So who would like to go first? Thank you. So we'll go to Joan Ebert, Superintendent Ebert, and then Jana, and then Taylor. Thank you.
Thank you. First of all, I'd like to thank, I'll just use my teacher voice. First of all, I'd like to thank the Institute for having this, panelists and everyone else that did, everyone that survived.
I think it is on. If you'd like to, we're recording it, so that'd be great.
Great. So with that, as the panel was speaking, things that I want to double down on. Number one is, the small government piece and diverse government overseeing K-12 schools in our state. I had to work with 4 different health entities, right? 17 different school districts. And how do you bring all of that together in a crisis? Because we weren't built to be together, we were built as separate entities. So the Department of Education
did not have a school nurse to support all the nurses in the 750 schools. So that's one of the very first things we did. You talk about trust and those people on the ground. We have a wonderful nurse in Carson City who ended up leading all of the other nurses across the state, because she knew what was going on. They trusted her. She was boots on the ground. And so we convened the nurses, if it wasn't daily, those pieces just moving forward. So that is one piece that I think moving forward, you talked about, trusting the people that's been in my DNA and it continues to be in my DNA. Those that are closest to the work know what's going on. So continuing that piece is very important. And then as you were doing the last component of leadership, and I was just reflecting on myself, removing barriers. We have so many pieces that as sessions have gone on and people think of things, it's just that sandwich that keeps building and getting bigger. And so how do we remove barriers so that people can be agile and work together and move our state forward? So thank you very much.
Thank you for that. And Jana Wilcox?
Hi, thanks. Maybe this is a half reflection, half question, I suppose, to the panel and the research team. So my first reflection is, I heard a lot about renewal mindset and sort of when you were sharing some of the findings, and we heard a lot from the panelists around sort of the crisis response. And what I'll say was like the first 60 days, right? That was like survive, right? Nobody knew what was happening. But it lasted far longer than 60 days. And I think what feels missing to me in the themes that you all found, although you're just identifying them, and I'm curious from the panelists around this piece around trust, is where was the vision on what we were going to do on the other side that was going to bring us together to build the trust and connectivity and maximize the impact of the connective tissue that was built by what the superintendent shared, the MAC as you shared. And so I will say, as a resident and as a K-12 advocate, right, what still, to some degree, feels missing to me, and what didn't show up in the themes, which was really surprising to me, was how setting the vision of what's going to be true for us on the other side really becomes a unifying factor and trust builder for us to maintain the relationships that we built. And so I'm curious if that resonates with anyone else on the panel and or the researchers, because I think that's something I still crave for us to continue to drive forward. There was survival mode, and I get it, right? And there are long, lingering impacts in K-12 in particular, right? New York Times just put out an article about how kids just don't go to school anymore. Yep. Doesn't matter your income level, doesn't matter your race, doesn't matter how well you're doing. We no longer believe school is a necessary institution in our daily lives, right? And so maybe we're okay with that, maybe we're not. But I guess my question is, like, how do we set out what we want to be true? To your point, Ryan, about what is the not normal, what is the next phase, and I'm just curious if that resonates with anyone else.
Thank you, Jana. Anyone?
Yeah, I'll just real quick. I mean, it has to be intentional. So we, early on, and we looked at this as a short-term health crisis and a long-term health, economic, and social crisis. And so Rob Lang, who's no longer with us, Mayor Lee and Marilyn Kirkpatrick, they wrote an article in The Sun that talked about the immediate crisis. Rob and I followed it up the next week with an article in the Sun, on the Sunday paper, that talked about the long-term crisis. And so one of the things that we did in North Las Vegas is we had what we called 2 camps. There was the camp that was dealing with the immediate, right now. And then you had the other camp, and that other camp was jealous of that camp because they were like, well, what's going on? We're like, don't worry about that. Like, we need you to worry about putting it back together, because it's real easy to go out and mow the lawn. It's really hard to go back and figure out where if you have to put it all back together, like, where does this piece of grass go? And imagine you have to tape all the pieces of grass back together. That's essentially what you have to do. I think that back to my comments earlier on a purposely structured, weak government, state level, the weakest organ of that is the legislature. Like they were really, the founders really wanted a weak legislature. So the reality is the leadership has to come from the legislature. They have to come back and talk about how do we intentionally have systems within the state that recognize the problems that we had during COVID and deal with those. And they have to have the appetite to do that instead of showing up to the building with what they're showing up with. And that probably needs to be let out, quite frankly, maybe by the governor's office or by another office that's there all the time, not just every 120 days, every other year, but they have to be intentional about it. And you have to be willing to say, these are the lessons that we learned, good or bad. These are the things that we need to be prepared for because there will be something else that'll happen in our lifetime. And that's really what we have to do, because it is, what do we do now? And that has to be regionally. I believe we work better regionally now than we ever have before because of these connections that we made during the pandemic. We have to elevate that. We have to leverage those relationships, and we have to figure out how, I think from the policy standpoint, make it permanent.
This is the first time I have spoken about the pandemic since it occurred, despite the fact I felt like it was a third cabinet job. My office also, I had a team of people looking forward, and we produced 3 reports for the state. Some of it's been implemented, some of it hasn't. They are on the Go Ahead website today. There was a great forgetting after the 1918 pandemic, and I fear that we're in that same situation now, is that in pandemics, there's biblical something about it. This is something we want to put out of our mind, and we need to keep it forward. In the military, there's always an after-action report, and then there's always a study on, we haven't done that in Nevada. I think that would be a useful exercise to figure out how we strengthen these things. The emergency response system is designed for floods, hurricanes, tornadoes. It is not designed for pandemics, and that has to be addressed.
Thank you.
For me, excuse me, for me, I think it's a new relationship between how we do accountability and remove barriers to access. And like I said, that's my theme that I learned. So it's important to be accountable at any level and with any sector. But I think that in that effort to be accountable, we've created many restrictions, and those were lifted during the pandemic. But now we're like, okay, back to normal.
I would just share that in the nonprofit sector, particularly those of us that used ARP dollars to get assistance out to the community, we're probably going to enter into another panic mode in our sector because there's a fiscal cliff, right? So all that we've done and all that we've expanded, and this is pretty cool that we can do this. The fact of the matter is ARP dollars are coming to an end, and there aren't any monies to carry on those things, but there are still folks that need those things, and so we're going, like you're probably going to, for us, we're not on the other side because we're about ready to do our own panic mode again because of the fiscal cliff that the ending ARP funding is going to bring upon those that need services.
Jana, thank you for that question, because I think it really is a broader question in terms of what is our vision, perhaps not just as a region or a state, but as a country, right? We are at a critical juncture. And what are our values? What do we really value? What are we willing to put on the line and align our policy and resources to? What is our vision? Now, some of us may be able to respond quite quickly. Some of us maybe refer back to historical documents or experiences or what have you, but I think it's a broader question that we need to have collectively, because not everyone's vision is going to be the same, but we do need to identify what are the commonalities. After all, that's one of the things that made this country, right? As imperfect as it is, and a democracy still in the making and trying to figure it out. But I think that if we're still here, it's because we believe in something as a collective. And so what is that something? Taylor, I think you had a comment.
I do have a question, but I also wanted to thank you for your comments. I loved having the opportunity to work on this project last academic school year, and we did learn a lot, and trust was something that we did speak about a lot, and really trying to understand how to sustain these communication pathways and what that looks like in the community. So I think trying to figure out where that falls, from a community-based oriented lens, but also what that looks like as we start to integrate these lessons learned into our policy and our practices and institutions. There's a lot of things I could say, but I'm just going to keep it brief and short. And also regarding your comment on schools, I study belonging, and it's really interesting that because people disengage physically and mentally when things don't meet their needs, when environments aren't meeting their needs. And so I think school, as it has been, does not currently meet the needs of the people. And so I think it's time for us to start to revolutionize what that is, what we need, and how we start to develop those systems. So I really want to say thank you for even making those comments. And my question had to do with public health, right? And understanding public health as crises. And we had COVID-19, it swept the globe, but even thinking more specifically about the state of Nevada, something that I was always talking to Dr. Martinez and Dr. Beavers about was the fact that we had a Senate concurrent resolution come out in 2021, and they declared systemic racism as the #1 public health crisis facing our state. So that was surpassing COVID. And so thinking about how we understand the lessons that we've learned here, how can we start to apply some of that into addressing this public health crisis that is ongoing, it's systemic, and it's very insidious in our nation? And then also, I'm also on the December 6th Memorial Committee right now, and we're trying to understand what to do to honor the lives lost, but also address such crises. And it might be a more isolated incident, but understanding what we can do and how we can be more preventative in our awareness, mental health, and all the things. So those, it's kind of a two-pronged, but how do you think we can apply our lessons learned in COVID to situations like addressing systemic racism, and then like what happened on December 6th here on our campus?
Good questions. So how do we apply the lessons learned to something like systemic racism and other types of crises like gun violence?
Yes. Acknowledge that it exists, right? We had a pandemic. Is there is there injustice in, right? That I think there's that. And then for us, it's going about really looking at your policies of how you serve individuals. That's, for us, it's very, let's get it out there. But are we allowing for appropriate, for lack of a better word, marketing of the services? Like if people don't know you have them, how do they access them? Thank you for their very loaded question.
This death of expertise has to stop. Don't surrender the space to those that don't want to acknowledge that there are real experts about these things. We knew in the 21 session, Legal Aid wanted to extend the eviction moratorium, and there was a stack of health data that said that if you evict folks, your public health is going to get worse. And then there were a few people over here that had a different view. I'm sorry. It does, their ignorance, it does not equal this expertise. And so I'm glad to be part of this institution now here, still trying to push expertise in a market that, it's extremely difficult right now to talk about real things, but don't surrender that space.
I think it's important as the white guy, right? It's sometimes a difficult conversation to wade into because I don't have some of that historical perspective, but yet I think it's very important that we do what we can to learn it. So for example, just yesterday I was talking to my finance director because I'd given him a book called Bonds of Inequality. And this is a great book that talks about, and he's, we're working on some ballot questions in North Las Vegas. And what I love about this book is it talks about I'm extremely paraphrasing it, but it's how many times you will have wider areas that will pass bonding for their parks, but then sometimes minority areas, they won't. We have a real unique opportunity in Southern Nevada because just because of the nature of how quickly we've grown, even though we did have an area of town that was segregated, we are one of the most desegregated metropolitan regions in the entire country. And that is not just a credit to, that we're all non-racial thinkers, or it's really a thing of circumstances, which is there's always, every town has another side of the train tracks. We had it here too, but the difference is with our explosion of population, you don't have people confined to certain areas because of their characteristics of their skin. But that also provides a wonderful opportunity for us because there is that diversity that we have within the community. There's the desegregation that we already have. And that's why in North Las Vegas, we're being very intentional when we're addressing, like, these things existed. What can we do with the assets that the city has to address these things? Because there are purposeful and intentional ways, but you have to be mindful of it. You have to recognize that this is real and that it's not just something that people that experience life in a different way are feeling and talking about. Because you got to remember, we didn't just have the pandemic, but we also had a reckoning during the summer of 2020 that has changed the way we recruit, the way that we look at our police department. And we've heard about trust, we've heard about truth. We are in a very difficult space as a country, mainly because of self-selection bias and all these other things that go into how we consume information in news. It tends to confirm our own beliefs and opinions. So we reinforce those things regardless of what our opinion is, and we get down these rabbit holes. And we move away from the truth, we move away from the problems and the data that says this is what it is. I don't know how you do that unless you turn off Al Gore's internet, right? Like, how do you fix that? But from a government perspective is not run away from it. From the perspective of people that are out there in the community in this space is be compassionate when you're talking with other people, like a white guy. That sometimes for me, I feel, when I'm talking with civil rights leaders and things like that, I'm like, I don't want to say the wrong word. Like, what's the new way to do it? Where I'm talking with people from an LGBT community, I'm like, is there another letter on this? Like, I want to make sure that I'm recognizing them for who they are, their story and their voice, but just because I'm not in that space all the time, to not then prejudge or judge me as I try and work through these issues. And I think that kind of tolerance is something that'll help a lot on both sides. Because I don't know your life, you don't know my life, but our ability to trust each other and our ability to work through the obvious that's there, unless we just want to go down some rabbit hole, that's what we have to do.
Thank you.
I'll quickly just add, racial disparities are real, right? It's been proven, and there are consequences of decisions made over the past few years, so we know that. And we are now the leaders in this space responsible for making policy decisions. So how do we invite those people that haven't had a voice? And it can't be that public comment period that happens, and that you post it somewhere or it's a link you have to go to. We really have to create welcoming spaces for everyone. And as leaders, we have to look for people that have felt disenfranchised. So it's not just like, well, I said everyone was welcome, so why didn't they show up? We actively have to put our resources and time in going out and looking for those questions and answers.
Thank you for that very thoughtful question, and we are just about out of time. We hope that this will be the one of many conversations that we will have. We really appreciate all of you being here. And Kellyanne, I think, has some closing remarks.
Yes, and given that we are at time, the primary thing I wanted to say was in response to Jana and Taylor. Number one, that my vision and hope is that as we move forward, the Lincy Institute can serve as a facilitator to field input from all of you in the various sectors that you're in about not only what your vision might be, but the challenges you're experiencing in moving toward a vision. And I agree that the legislature is a necessary leader in terms of making these things happen, but also what we want has to be brought to the legislature. And that means that before the legislative session, as a community, the best thing we can do is become clear about that vision and how we can ask for what we need and push for it. But I can't articulate that to the community, but the Lincy Institute as an institution can serve as a listening podium to hear from you all how we can be supportive in making your vision real, and that if that's facilitating spaces for dialogue about some of the hard issues like Taylor referred to, again, I don't want to put words in the mouths of what the best things would be, but we are here to listen and to be a support for the community, and I think that we all have a lot of work to do, and I am humbled and grateful to be a part of it. So I appreciate both of your comments.
Thank you so much, everyone. We really appreciate you. Thank you to our speakers. If we could take a picture.